should be around here. So let's see if we can manage.
Of course, do you use systematically curved fast fix?
Yeah. Yeah, it's always curved fast fix. I never use the straight fast fix. So this is the situation. I'm gently pulling. Now, you could over-pull these sutures, and then the effect is that you slightly dimple the scaffold, but this, I can pull pretty hard onto the, maybe an outside view.
The pull is a very important step.
Yeah, you see. Absolutely. So don't over-pull it, but just pull it nice and snug, but don't over-pull it.
It's easy to say, but it's perhaps difficult to do. Do you have some tricks to know how?
What I normally do is I pull until the small knot, I see him slightly move towards the T2, from T1 to T2, but I never tend to really get to the T2 point. Once the knot is snug, I stop. I don't over-stress it to the T2 point. So that's maybe important. You see the knot itself is still somewhere in the middle. It's not on the meniscus side. Maybe that's an important remark. You don't, because normally with the fast fix they say that you have to push it to the T2 point. That's not necessary if you do an implant with a scaffold. So there we go. I cut this one. Yeah, pull. Okay, excellent. And then this is the situation. Gonna use the palpator, the teaser. Aspect here, the suture was a little bit long. That was but we're gonna address that later on. Okay, this is the position on the posterior horn, as you can see, and already pretty stable. I will push this one in, you see. Kind of a press fit sensation. We'll use here the fast fix device again. I always test if I can reach the position with the fast fix. If the position, if the position is incorrect, I switch portals and come in from the other side. Okay, you can take out the blue one. Vrij voorzichtig, yeah. Okay. Again, and as you can observe here, we're going to do horizontal sutures. There was a question yesterday on horizontal versus vertical sutures. I have more scaffold material underneath my suture using a horizontal suture than I have. So this tissue underneath is rectangular. If it's a vertical suture, the tissue underneath my suture is triangular. So I have much more tissue using the horizontal suture. That's maybe an important remark. And so there we go. Scaffold, rim. Relax a little bit again. Okay, second suture. There we go again. And so the distance in between the sutures generally around 0.5 centimeter. Okay.
How do you match the scaffold with the peripheral rim? How are you sure that you are on the right place?
Maybe Philippa will answer that question just in a minute. What I'm going to do first is tie the suture, because this will nicely illustrate how tight I make it. On your left T1, on your right T2, I just pull it. And once I see the knot here, engage. This is more than good enough. You don't have to really, I can pull it maybe 0.5 centimeter more. That will just dimple and compress the scaffold. That's not necessary, not for stability, not for ingrowth. So this is the situation. And what was the question again, Philippe? Sorry, I forgot.
How do you be sure that the scaffold is in the right place regarding the peripheral rim, not too high, not too...
Well, the press fit situation as you have it here is already a guarantee for a good positioning. On the medial side, what I do, this position will almost always have the correct height of your meniscus, right? Only if you overstretch, the meniscus once in a while lifts off of the tibial plateau, and then maybe you can position it incorrectly. But by just relaxing and putting in the scaffold in between the femoral side and the wat is dat hier allemaal? Ja, het zit iets in. And the tibial side makes it snug. I had a technical difficulty by passing the fast fix, so we're gonna. Oh, wacht, staat hij op? Is dat toe misschien? Yeah, should work now. Needle. And give me just the duck bite. Okay. Kun je hier even houden? Lin, een keer. I'm gonna just do it with the duck bite. Oh, that. So the nut pusher and cutter was a little bit struggling, so I'm just gonna do it this way. Okay, excellent. And so now you see we were oversized just in the beginning, and you see how this comes into place and assures you a snug fit. What I'm going to do now is I'm going to switch portals to make sure that my fast fix device comes in as rectangular as possible on the meniscus rim. So here we go. Switch.
Peter, this leads me to the question. It looked already when you did your second fast fix that you came quite oblique. And
yeah.
Would you have done it if you would have made a meniscus suture in the same way, or is it because you wanted to push the implant a little bit more posterior because you have oversized it?
No. Indeed, I was doubting if I was switching for the second suture already, or I would do it for the third suture. But so I decided to do it for the third suture. But indeed, you could discuss the fact that my fast fix already came in a little bit more oblique than perfect. But I mean, it works, right?
Yeah, and you pushed the implant a little bit posterior by that way.
Well, that is, yeah, absolutely. That is what's happening if you work from the anterior side and your lesion is in the back. Every suture, in fact, pushes your scaffold a little bit more to the back. So that's why you need to oversize from the beginning. Misschien de teaser. I'm going to double check if my portal is okay on the lateral side and if I can come in as perpendicular as possible. There we are. And you can see already that here at the anterior horn, the entrance of my fast fix will maybe be a little bit